Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm talking with Dr. Edward Abraham, the Chief Medical Advisor at Bright.md. How are you today?
I'm great. Thanks for having me here.
Absolutely. I'm excited to chat. I think we should dive right into it. It'd be great if you could tell the audience a little bit about your background, and then we'll talk more about Bright.md.
Great. So I'm presently the Chief Medical Advisor for Bright.md. Previous to this, my whole career had really been in academic medicine. I was the CEO of the University of Miami Health System, was the dean at two different medical schools, the University of Miami and Wake Forest, and had been at a lot of other large academic medical centers, Stanford, UCLA, University of Colorado, University of Alabama at Birmingham.
Are you still in Florida today, or did you since move?
No, I'm still in Miami, still in South Florida.
Oh, I have some family that are in Davie, so not too far from where you are. I actually just moved to Tampa from Boston, so I'm on the other side.
Tampa now. Yeah.
Yeah. So I'm part of the Florida health ecosystem now, right? It's continuing to grow. And I actually had a cousin that went to Wake Forest for medical school couple years back. So really cool that you're down here.
Yeah, and Florida, I mean, as you know, as you're discovering, is an incredibly vibrant place. A lot is going on, incredibly diverse, a lot going on with healthcare, and just a fascinating place to be.
Yeah, we're taking all the best parts from some of the, which was what of the like New York and the Bostons and the Silicon Valley areas that were very pro innovation and really big in the health tech space are now moving down here, and they're bringing that level of innovation and along with the current community, right? It's really cool to see this diverse community of entrepreneurs and thought leaders and everyone trying to make healthcare better. So it's exciting.
Yeah, and it's also very international. So this reach out, particularly to the Caribbean, Latin America, but Europe as well, it all adds to the mix in South Florida.
Absolutely, I love it. Well, reason you're here today is to talk more about Bright.md, and I know there's some other topics you and I want to go through, but I'd appreciate if you could give the audience a little bit of an overview of Bright.md, and then we'll talk through some of these questions you and I wanted to talk about.
Yeah, so Bright.md is a highly innovative, digitally based healthcare company, primarily had been focused on what's called asynchronous health. So those are approaches where you can respond to questions, you can respond to approaches, doesn't have to be in real time. You can do it on your own schedule where you live and work. And the issue was really, is there a better way to address primary care problems? Is there a better way to address your health needs if you have a cold or perhaps a urinary tract infection or other kinds of common issues where normally you'd go into an urgent care center, go into a clinic, waste your time in a waiting room, but want to get an answer, want to get a therapeutic plan where you live, where you work 24/7. And so Bright.md was really set up to address those kind of issues.
I remember I first heard about Bright.md back in, you and I were talking about this before the call. It was, I think, 2019, right before the pandemic, at one of the World Congress M-Health deals out in Boston, and was able to learn more about the company, and have since then stayed in touch with Ray Cassini over there. I might have butchered his last name. I tend to do that. But that's how I continued following the progress. And then you and I linked up, and I'm excited to have you on today. One of the questions I had for you in regards to Bright.md, but also just your overall opinion as a whole, was why health systems should bring asynchronous care into their digital strategy. I'd be really curious in learning your thoughts on that.
Yeah, so I think it comes back to the question of why have a digital strategy, first of all. And I mentioned this just a moment ago. It's so that you can reach out to patients where they live, where they work. This was already there before the pandemic, but has become even more important during the pandemic with telehealth, for example, where you could, health systems needed to stay in touch with their patients, and they couldn't come into their clinics. And what they realize at the same time is patients don't really want to take time off from work for common problems and come into the clinics if they don't have to. They'd much rather get their healthcare issues taken care of in a convenient way, where they live, where they work, on their own schedule. And so the issue with Bright.md and with digital health has been adding this portfolio of activities. So telehealth is sort of limited. You have to schedule an appointment. It takes 20, 30 minutes, just like a regular face-to-face appointment. What can be done with the Bright.md approach is very quickly go through a series of artificial intelligence enabled questions to get to the nature of your problem, get to a diagnosis and a therapeutic plan. And so from a health system point of view, this is a very efficient way of providing care. From a patient's point of view, this is great because it's done when you want. And from a physician or nurse practitioner's point of view, it's great too, because for these common problems, instead of taking 20 minutes, it only takes a couple of minutes to deal with the patient and deal with the problem. And you can really use your skill set for much more complex problems. So it's a great satisfier on all sides, for the patient, for the provider, and for the health system.
Yeah, I think whenever you're simplifying things for the organization and also the patient, everyone walks away happy, right? Because healthcare as a whole, before like a company like Bright.md, that process was not very fluid, right? It ended up frustrating more people.
Yeah, healthcare is incredibly cumbersome. It's just setting up an appointment, taking time out of your day, getting asked questions, having to do co-pays and billing. It's horrific. And anything that will simplify that, anything that will make it more convenient, and Bright.md and its approach to asynchronous care absolutely does that. So it's an incredible advance.
Absolutely. Yeah, it's a great name, by the way. Perfect name. Yeah. Big fan of the company name and the branding behind it. So Ray and the rest of the team over there, you guys did a great job with that. Another thing I want to ask you is, oftentimes when we hear digital health, the first thing we think of is telehealth, right? Yeah. And I think sometimes people confuse the two and think digital health is telehealth. Why is digital health more than telehealth, in your opinion?
So telehealth is just one component of digital health. And in a certain sense, it's not really dissimilar from a regular clinic visit. It's occurring on a screen, of course. You're seeing your provider, but you're having the same kind of interaction. And digital health, as it's developing, is much more. It's these asynchronous approaches that we've been talking about with Bright.md. It's wearables, Apple Watches, and other wearable devices that tell you about body functions, heart rhythm, tells you about your blood pressure, going to soon tell you about your blood sugar and other parameters. And so it's really a way of monitoring patients, monitoring individuals, because many of them aren't patients, they just have health issues that they're concerned about, and addressing whether there needs to be an approach to them and what that approach should be. So there's that one component of telehealth, but then this whole developing ecosystem of other approaches to dealing with the healthcare issues that every individual faces in our society.
Before we start to wrap up here, I had another question I wanted to ask you, and that's, it can really be anything, but what's next for the company? And really, what are you looking forward to? I know sometimes you can't always say what's next because maybe it's a secret, right? It's a new thing coming out and you're not announcing it yet. But I guess, what are you most looking forward to? What's next on the horizon?
Yeah, I think the biggest thing for us going forward is becoming a bigger part of the portfolio of activities for health systems, for providers of healthcare. From a patient's point of view, you don't want to have to deal with the electronic medical record and get inside. You just want to be able to access healthcare right away. And so Bright.md is thinking very much about how to do this, how to make it easy to get your healthcare issues addressed, answered, taken care of quickly. Again, in a convenient way, in a friendly way, and do it in a way that, the consumers really want. And the consumers being all of us as individuals, because we all have health problems.
Absolutely. Yeah, no, I'm super passionate about the mission that you guys have, what you're continuing to roll out, and am very excited to see how things continue to progress moving forward. Hopefully we can have you and other members of the team on again soon so we can cover some different topics. But I just want to thank you again so much for being a guest on an episode of Slice of Healthcare, and I wish you all the best of luck.
Yeah, thank you so much for having me. It's just great.